I actually first met a physician assistant when I was in the hospital in the emergency room with abdominal pain when I was younger. And the PA who treated me made me feel heard, made me feel comforted, and taught me a lot about what I was going through. And after that, she called to follow up with me, and that made me feel really valued as a patient. And after learning more about the profession, I started shadowing physician assistants in multiple different specialties. And the thing that I really like about shadowing is I got to see the collaborative environment and the relationship between a physician and a physician assistant. And so now I have the opportunity to work alongside Dr. Ashley Beale, and we see patients at the Rockville office. I was drawn to rheumatology and specifically to ARA because my mom was initially a patient here. She was diagnosed with a rheumatic condition when I was in high school, and I used to accompany her to her appointments to help her communicate with her doctor and vice versa, translating between English and Vietnamese. This was also my first exposure to medicine. My mom is the reason I pursued rheumatology at ARA because of the compassionate care she received while under ARA's care. I aspire to become a provider who can provide the same level of care to my patients and give back to my community. Being bilingual allows me to build relationships with my patients and help those in the same position I was. During my training in PA school, I developed a passion for diseases of the musculoskeletal system. I saw firsthand how arthritis and chronic pain affects so many people worldwide. In my practice, I love to be able to perform hands-on physical exams and utilize x-rays and ultrasound to help formulate a diagnosis. I find it rewarding to be able to show my patients tangible evidence of their disease and to educate them on treatment options. When I come to work, I get to learn a lot about my patients, whether it is about their work, their most recent vacation, or hearing stories about their family. Outside of work, you can find me at the gym, listening to my favorite podcast while on the elliptical. I also enjoy trying new restaurants and making new cuisines at home, trying new recipes. When it comes to my patients, I think having them feel heard is the most important part of patient care. It takes an active listener and giving them that extra bit of time during their office visit to make sure that I don't miss anything.